Dr. Faisal Shuaib, thank you for agreeing to be interviewed by Ebola Deeply.
My pleasure.
Let me start by asking you your thoughts when you heard that there had been a case of Ebola in Lagos back in July. Around the world, the news was greeted with horror. People were talking about doomsday scenarios. What were your thoughts?
I think they were exactly what most people thought. Of all the places in Lagos, no, not Lagos, in Nigeria. It's a cosmopolitan city with a population of over 21 million. You know, dropping Ebola virus disease, given its infectious nature, was the least I wanted to hear. And I said, oh my God, not Lagos, not Lagos.
You were appointed the head of the Ebola Operations Center. How did that come about?
Yes, so I'm currently the Deputy Incident Manager of the National Polio Emergency Operations Center, and we've been dealing with the polio emergency since 2012, when WHO declared polio eradication a public health emergency. And with the outbreak of Ebola, it was clear that we needed an incident management system to be able to contain this public health emergency. And given the success that we've achieved with polio eradication, moving from hundreds of cases annually to single-digit figures, people just looked at the right place to choose an incident manager and say, okay, it's got to be people that have managed emergencies, and have done it creditably well. And that is why I was chosen.
And talk to me about the center. How exactly did it work?
So the Ebola Emergency Operations Center uses a war room approach towards containing the Ebola virus outbreak. So we have a dedicated team sitting down in one place, one designated space, where you have, under the leadership of government, international development partners such as WHO, UNICEF, the U.S. Centers for Disease Control, and MSF, Médecins Sans Frontières. Under the leadership of government, we do joint planning, arrive at a unified plan on the strategies that need to be taken to contain the Ebola virus outbreak. And this is implemented in a way that emphasizes accountability in terms of strict timelines, accountability in terms of people working together as a team, knowing that you can't drop the ball, because if you drop the ball, then you're letting the team down. And that's the kind of spirit that we worked with during the outbreak.
You know, I keep hearing from people that the key to success for Nigeria in defeating or containing this outbreak was contact tracing. Was that the key? Talk to me about why you were able to be successful.
Without a doubt, contact tracing was very central. Leadership was very key as well, providing the leadership to ensure that all the trains are moving, making sure that all the paths are moving we're moving at the right time. But when you come down to the real basics, to the real details, then you've got to give it to contact tracing. Those are the boots on ground. We looked at, when you look at the data, it was a situation where we had over 800 people being traced, almost 900 contacts being traced, over 18,000 house visits. We had medical doctors, nurses, allied professionals actually going to the houses, workplaces of some of these individuals to line list them if they had any contacts whatsoever.
So you actually went to workplaces when necessary?
Yeah, when it was necessary to track down a contact. Immediately we heard that a contact had been exposed to a case, then we will track them down wherever they were. So we had boots on the ground, people that were going to these places. At home, after telling these contacts to practice social distancing, they will go to their houses on a daily basis to monitor them for symptoms and also do a recording of their temperature, so that once they exceed that threshold of 37.5 Celsius, then we evacuate them to the treatment center.
There must have been challenges. The first one that comes to mind is just contact tracing in a place like Lagos, with a density of population. I mean, that is no. I've been to Lagos. That is no easy feat. I mean, talk to me about the challenges, because I always feel you learn a great deal from the challenges that are overcome.
Right. It's very clear that to do detailed contact tracing, that like we did, to be able to isolate very early these contacts and investigate them thoroughly required a lot of resources. And right from the start, the federal government, working with the Lagos and Rivers State government of Nigeria, made resources available. And this was one time where we also had partner agencies, actually coming to the table and providing resources such as vehicles to go to some of the hard-to-reach areas to ensure that wherever people lived, there was a means of getting across to them. In places like Port Harcourt, we had contacts living in riverine areas, and people had to use boats to get to them. What we did was to use an abundance of caution. We cast a wide net to ensure that everybody that had any form of contact with a case was tracked down rapidly, so that as soon as possible, if they were to develop symptoms, then we're there at their doorstep.
Did you use GPS? I read somewhere that GPS was employed.
Yes, this was something that we did. So what we sort of did was to map out where all these contacts were staying. Using mobile technology, it was possible to record their temperatures. So at any point in time, if the temperature exceeds that threshold, there was a feedback mechanism to the command center by an alert system that's flashes red. Okay, here's somebody at X location that has developed a fever, and then using an evacuation team, they are rapidly evacuated.
That's
so
incredible.
Yes, this was something that we found quite useful, and I understand some other countries are looking to replicate this.
As you talk about other countries, what are the lessons here for other countries? What can people take away from what Nigeria has achieved here?
I think overall, with rapid, cohesive action, it is possible to defeat Ebola virus disease. It requires leadership. It requires preparedness for those countries that do not have cases right now. It is important to move rapidly with the first single case to isolate the case and investigate them. Delay is dangerous. This is one situation where you cannot afford to delay, because the virus seems to have understood the behavior of humans. It knows that when people are sick, then friends and relatives crowd around them. It knows that when people die, that people weep, people give them baths, and this is where people get infected. So people have to be very cautious, must understand very clearly that once there's a case of Ebola, then there should be social distancing that people practice, and they should report early to the treatment center. And then one thing that we've come to realize is that panic doesn't help. Panic and fear slows the response. So health workers need to be very clear in their mind what kind of messages they have to sent to the communities, and community members, are often misinformed by people that do not know better. Now, once there's misinformation, there's a need for the program, for the response to counter that information as soon as possible. And clearly, once some of these key steps are taken, then it is possible for us to change the trajectory of Ebola virus outbreak, be it in Sierra Leone, Liberia, or Guinea. It is possible that if we mobilize resources, if we mobilize health workers, if we mobilize the right kind of materials, supplies to these countries, then we can actually stop the outbreak in the shortest possible time.
And these lessons that you're talking to me about, are they being shared with other African countries? I mean, how are you sharing those best practices?
Yes, we've had discussions with some of the key players in these African countries. Even as I speak, I know that they're just finalizing the setup of their emergency operation centers that are replicated what we have done in Nigeria. Where even next week I have a discussion with one of the ministers of health from one of these affected countries. And then there are volunteers from Nigeria that are now preparing to go and support the outbreak in these countries. We make it very clear. The best way to end this outbreak in West Africa is to go to the source, to go where the outbreak is happening. It doesn't help for us to close our borders. It doesn't help for us to keep our distance. That is why we moved from Abuja to support the Lagos State government. Like, Nigerians love to play soccer. We say the best way to defend is to attack. So what we need to do is attack the virus from the source. Be there on ground with the Sierra Leoneans, with the Liberians, with the people of Guinea, and ensure that we mobilize all the resources that are required to ensure that we stop the outbreak.
How concerned are you that there'll be another outbreak in Nigeria?
As long as the outbreak in Sierra Leone, Liberia, and Guinea continues, there's always a threat, and that is why we're not letting our guard down. We're still continuing all those interventions that are critical to ensure that we don't get an importation. We're screening in all ports, the airports, the seaports, the land crossings, to ensure that people that are crossing that may have symptoms are actually isolated and managed properly. We're still doing active surveillance, collecting information, asking from people in the communities, in the health facilities about Ebola virus disease. And then we continue to increase awareness around Ebola virus disease. We make it very clear. Yes, we've contained this outbreak, but by no stretch of the imagination do we think that the threat is over. As long as we continue to have this outbreak in these neighboring countries, then we are always at risk. The case in point is what has happened in the US as well.
Your main focus day to day has long been polio, and then you got shifted to Ebola. What are you doing next? Are you going back to working on polio, or are you going to stay in charge of efforts to ensure there isn't a second outbreak of Ebola in Nigeria?
So one thing we've done throughout the outbreak is to do capacity building in the states, and we're doing preparedness. For those states that were not affected, trainings have been conducted. We've developed standard operating procedures that people are familiar with. So we believe that we've transferred enough capacity to the states such that if we have another importation, that the states will be able to manage, comprehensively. So I'm back to working on polio. We're this close to finishing the work with polio, stopping transmission in Nigeria so that Nigeria stops being endemic for polio. We're now in single digits, 6 cases this year. Last case was in July. So I'm back to the trenches working on polio eradication, and I think we're going to do it this year.
Well, I wish you the very best in the fight against polio. Congratulations in the success against Ebola. Dr. Shuaib, thank you for speaking to Ebola Deeply.
Yeah, thank you very much, Aisha.
Thank you.
Okay.